All right, everyone, welcome to this live conversation with Dr. Bolanle Akinsola, who is a pediatric emergency medicine physician in the US with training in Nigeria as well. I don't think I've ever interviewed a doctor on Tech Roundup, but these are unprecedented times that we're going through, and we think that she can share a lot of knowledge and clear some of the myths and information going all around. So Dr. Akinsola, welcome to the show. It's good to have you. It's a privilege to be talking to you. I know you are very busy. To get a doctor for 10, 15 minutes in the US now is like gold. So thank you. Thank you for taking some time to join us. So let's start. You're on the front line. You've seen many cases of patients with coronavirus. You work in emergency. I've been monitoring this. I've actually been capturing data from March 20th, when the number of cases globally was cases in the US, was just over 13,000, and 195 people had died at that time, which, when you compare to the number of deaths around the world, was just less than 2%. Today, 1st of April, as at this time that we're talking, the US has recorded 4,669 deaths from coronavirus, which is now over 10% of total deaths recorded across the world, which, obviously means that the rate of death in the US is growing much faster than anywhere else in the world by that data. What do you think is happening? What's going on here? Because it's becoming really scary.
Yeah, so first of all, thank you so much for having me. I'm glad to be on your show. So you're absolutely right. The mortality rate, mortality just means the rate of death, is really, really skyrocketing. In fact, if you have been listening to the news, the projected mortality rate that they're talking about in the United States is like 100,000. I mean, that is ridiculous and mind-boggling.
Yeah.
And like you also rightly pointed out, the sharp distinction, or the sharp contrast between when it was first of all reported to what it is now, just points to the fact of how virulent and how infectious this particular strain of this virus is. Now, the even more scary part to this issue is, which is probably why we're having all these numbers, is like it's a new strain, it's a new virus, and so the scientists, we don't know how it's going to act. We don't know, is it going to, like how the flu virus, for example, how you have different strains, you're like, is it going to form different strains? Are there different strains coming up? And so we don't really know this virus very well. We know it's highly infectious. We know it's highly virulent, which just means the rate of infectivity. And we know that it's causing a lot of mortality and morbidity. And so, yes, this is what is going on. It is because of how the virus is, and because and that's why, if you notice, they call it the novel, the new virus. So we're learning with the virus.
The scientists are learning to deal with it.
Exactly, and that's why, hopefully we'll talk more about it during the course of our discussion, in terms of all the different studies that they're trying right now to see. It's all in trial phase right now. There's no definite cure, like maybe this will work, maybe this will not work. Yeah. So we're basically dealing with it. But yes, those statistics are mind-boggling, but those statistics are true.
Go ahead.
That it's something small and it's this high. And not only that, there's also potential that it could even be much, much higher.
Yeah. So the reason why I brought that up, first of all, it's important to understand those numbers, but also that Nigeria, which you and I are connected to, today the numbers are much lower. In fact, the numbers are comparable to where the US was 3 weeks ago. Now, I'm not projecting that Nigeria is going to be where the US is in 3 weeks, but it could happen, right? We don't know. Like you said, we don't know.
Hopefully not.
Hopefully not. We don't know how this is happening.
Yeah.
If it does happen, what have we learned now with where things are in the US that, administrators, the government, and even ordinary citizens can begin to learn to prepare for such a surge? Hopefully it doesn't happen.
So that's a very good question, and I'm so glad you brought up that question. So I think Nigeria can learn, or the world can learn a lot from the United States. I'm sure you've heard there's a lot of politics about, poor response. We're not going into politics here. Yeah. But the truth is that I do not believe, and that is what the people in the scientific community believe, that this was not approached in the manner in which it should have been in terms of the urgency.
Okay.
Because I think initially it was felt that it was probably just another flu or like another virus. Nigeria can learn from the mistakes that the United States made, which is not having early testing.
Okay.
And not only not having early testing, and it's still the problem that we still have currently in the United States, not having enough testing, because this virus is droplets, right? And so that's for you to understand what the social distancing is, that's why we're doing social distancing, the 6 feet. So it hangs in the air, right? And so it is very important that Nigeria can learn from the United States by quickly making sure that they ensure the social distancing, people keeping away from each other, and testing.
Yeah.
I mean, unfortunately, I don't know. I mean, look at the United States, the greatest country, and we're still having problems with testing. I don't know what capabilities we have in Nigeria to test.
Yeah.
So I think the best approach for Nigeria is prevention. Because I feel that, God forbid, if we get into the dilemma that we're in the United States, I'm not sure.
Nigeria has.
I'm not sure that the healthcare. I'm not sure about the capability and the capacity
of the healthcare
system in Nigeria to be able to handle the kind of outbreak that we have right now.
Okay, so luckily, I know that in Nigeria, I don't know if it's all the states, there's already lockdown, so the part of social distancing is already being observed. Mm-hmm. And hopefully that goes a long way in prevention. Like you said, I agree with you. I'm not sure our healthcare system can really deal with the kind of surge that's happening right now in the US. Second question that I have is an interesting one. It's one that I've also been thinking. There are some myths out there going around. You look at social media, what people are saying. People are saying, oh, this thing doesn't affect Black people. People say, oh, people of African descent or people in Africa have an immune system that can deal with this. People are not likely to get sick. Even if you look at the cases in Nigeria, I think except for one, there hasn't been any mortality. I think one mortality in all the cases. So people are beginning to think that, okay, maybe there's something in us or in Africa that is making this not as serious as Please set us straight. Help us correct some of these things that some of these things that are going around. Are they true? Are they facts? Are there things that we should learn from these things that are going? And the other thing is chloroquine. If you live in Nigeria when you were growing up, I cannot count the number of times I had malaria, and that was one of the medications that we use. And people are saying, oh, because we've used that so many times, our immune system, is good enough to deal with coronavirus.
Yeah, so forgive me for looking down. I was trying to bring up an article sure. That kind of talks about, so that I'm quoted, because I want to quote the data and I want to quote it accurately. Okay. So you're absolutely right. There has been discussions about and people feeling maybe overly super confident that, oh no, we're Black. I heard someone joke that, by the time coronavirus comes to the ultraviolet heat of Nigeria, so I've heard really memes and jokes and all that. So like I said, the fact of the matter is, just like I said, this is a novel virus. So we really don't know how it acts. You're absolutely right. There have been some data and some talk about how the virus is going to react in warmer climates, because just typically trying to compare it to the flu, we typically have less flu diagnosis in the summer months. You tend to have more flu. You do have it. It's just not as, it's not like it doesn't exist. It's just that you don't have it as much as in the winter, the cold months. So trying to compare that. But people have talked about how there was also something in Brazil too about how in warmer climates they didn't have so much. So even though we call those, there can be an association, but we use the word, you cannot claim a causative association. In other words, you cannot say for certain that because of this is why this is happening. Okay. There may be other what we call confounding factors in such situations. And so even though people are talking about it, as of currently, the data has not, the scientists or are not 100% backing the idea that it's not going to replicate in warmer climate or in the warmer months. Now, like I said, it is a suggestion, and you're absolutely right. People are talking about it, but I still think that we should learn from the US and prevention, social distances, washing our hands, all those basic things that they talk about.
Yeah.
But it is true that there is an association, but it's not proven.
Okay.
Not proven, it's still in the works. It's not proven. And and like I said, because we're not sure it's an exact causative effect. We think there may be other confounding factors. Question about the chloroquine. Now, and there are studies that have actually shown that chloroquine, hydroxychloroquine, and azithromycin may have some effect against the coronavirus. Now, the effect that they're talking about is not the anti-malaria effect. These medicines also have an anti-inflammatory effect.
Okay.
I'm not going to go into all the details and bore you, but basically, cytokines that are released and all that good stuff. Okay. So it hasn't been proven. Same thing, but there is promise. And I don't know if you said you've been following the news. The FDA actually just recently agreed for there to be what we call studies.
I think there's some testing going on in New York.
Yes, they're called random control trials, where because for you to be able to finally prove, that's why when they're saying there's going to be a vaccine in 3 months, that's impossible. Scientifically, that cannot happen because there has to be, it's a phase. Yeah. So, but they're saying that since we've shown some promise, maybe we should do like a formal test, and that's where they are right now. But it is true, based on what is being seen now, that it shows promise. There are also some other medications, and what we call immunomodulators, typically used for people that have maybe like cancer, or people that have like rheumatologic disorders, that are also being trialed and have shown to show promise. Not proven, but because it's showing promise and this is a new virus, everybody's like, whatever it takes, we're going to. So correct. But remember, it's not for its antibacterial or the anti-malarial properties. It's for the anti-inflammatory properties of those medications.
Okay. That's a really good distinction, and hopefully people begin to understand the difference between what chloroquine was traditionally used for and what is being tried by scientists for coronavirus. And then the last question.
There was some overdose of chloroquine.
Yes.
It's not going to help to prevent. Remember, it's when the inflammation has happened.
Yeah.
And then you use it. So taking it to say it's going to help me prevent it is not going to work.
Yeah.
Because it's not like a vitamin to boost your immune system. I don't know if that makes sense. Okay.
No, yeah.
So clarify that as well.
I get that. Thank you. So there's no coming on this show and talking to me and not touching technology. I know that there has to be a way this is connected to technology, but I think there's a good way here. They're close to, from what I found online, they're close to 6,000 medical doctors in the US with some connections to Nigeria, whether they're from Nigeria or by birth or, immigration, whatever it is, right? So that's a good number of people that, one, are trained here, but more importantly in this situation, are facing the reality of coronavirus in an unprecedented way. And I couldn't help but think about how, a number of these physicians who are in the US might be able to remotely, using technology, help healthcare workers, healthcare professionals in Nigeria, if indeed, like we said at the beginning, God forbid, if indeed we see a surge in the number of cases of coronavirus in Nigeria. What do you think is possible? What can we sort of anticipate could potentially happen to leverage the vast experience of these Nigerian doctors in the US to help those back in Nigeria?
COVID-19 pandemic has shown the world that a lot can be done offline. I mean, can be done online. I mean, I think if there's one thing that the pandemic has shown us, that we definitely can live life a different way that we're currently living it.
Yeah.
I mean, currently now, because of this pandemic, because of enforcing the social distancing rules, everyone is doing Zoom meetings. Like, I mean, I had 3 meetings yesterday, administrative meetings that were done all on Zoom. I worked this today, and I was, so while working, I was able to, on the side, listen to the division meeting that was going. I mean, this is because they never.
First time I'm doing my interviews online, and I have a few scheduled for next week online as well. Yeah.
Exactly. We never used to do Zoom meetings. Those meetings were for emergency medicine physicians worldwide, and I'm currently part of that group where we actually have a group that we talk and we discuss about current things. One of the things that they were discussing is how to introduce the practice of emergency medicine, because that's one specialty that we don't have in Nigeria as of right now. And now with this COVID-19 pandemic, there has been discussions, pathways that that people are, in the front lines are developing that we can use to help. Now, this is just discussion among us, but I'm saying that those platforms already exist.
Okay.
So in a situation like this, I think technology can definitely help. Even right now, because of the because we're short of doctors, especially in areas like in New York, where they're asking for people to help, or they're calling on physicians who are not emergency medicine trained to help out because of the volume of patients. I'm finding out even currently on Facebook where doctors who are critical care, emergency medicine, ventilator experts are doing quick talk, like a quick 20-minute talk on how to handle the ventilator, like a 101 refresher course on. And this is within, for people who maybe have done that in a long time to kind of help to refresh their memory. So I definitely think that these are the ways that physicians in the diaspora can help if the situation warrants it. Like I said, pathways, platforms, refresher courses, and also wanted to say that there are platforms like that, and I am one of such a platform where people are talking and sharing ideas and sharing, contributing ideas and sharing different ways in which, this is what information, this is what's happening. And I feel that information can then be, transferred to the people who need it, if need be, using so many of the different platforms. You have Zoom, you have WebEx, so many platforms, even FaceTime, Facebook Live.
Yeah. Even messenger apps like WhatsApp can really be
exactly. So definitely think that if the situation warrants it, and even now, I even think even from right now, people are also already using technology to pass. I mean, unfortunately, media also plays a role. Making sure that we're passing on, because as much as we're passing on, saying that we have all this technology with the good information. You talked about the myths. The myths are also being passed. So going back, just remember to the question you asked about what Nigeria can do. Media, it's very important that, the media is also delivering the right information to the people, in addition to the other things that they want to do for prevention.
All right. Thank you so much. It's been a pleasure chatting with you. Personally, I've learned so much, despite the fact that I watch the news almost 24/7. And these days, this is all that is in the news. I still managed to get a lot of information. I'm sure a lot of people watching this would have learned a lot. Like we said at the beginning, we hope that the situation becomes a bit better. And I know that there's a dire outlook in terms of where this can really end in the US. We hope and pray that it doesn't get to that point. And elsewhere in the world, we hope that this thing goes away and we can go back to our lives.
I hope so too.
Thanks so much, and stay safe. You guys are in the line of fire, but please stay safe. We'll continue to.
Thank you so much for having me. I appreciate it, the opportunity. Thank you.
All right. Yeah.
Okay, thank you. Bye-bye.